Welcome to Doc Talk Dental, where dental industry marketing specialist Lisa Muller sits down with doctors, innovators, and thought leaders to share their stories, strategies, and insights. And now, here's Lisa.
Hi, everyone. It's Lisa Muller with Implant Practice US and MedMark Publication. Welcome to another edition of Doc Talk Dental. I'm very excited to be here with Dr. Mohamed Ali, leading pioneer of implant dentistry, with his world-renowned dental office in the heart of San Francisco's Union Square. Dr. Ali has dedicated his life to providing dental care with the help of obtaining doctorate dental degrees from the Aleppo School of Dentistry and the Loma Linda School of Dentistry. He has also held teaching positions within the oral and maxillofacial surgery departments of the Loma Linda University School of Dentistry, San Bernardino County Medical Center, and Riverside General Hospital. Dr. Ali's professional affiliations include membership in the Center for Dental Medicine, the American Dental Association, California Dental Association, San Francisco Dental Society, the American Academy of Cosmetic Dentistry, the American Academy of Implant Dentistry, Invisalign Certified Dentist, the Dental Board of California, and the International Congress of Oral Implantologists. Wow, that is an amazingly impressive bio, Dr. Ali. Thank you so much for joining me today on Doc Talk Dental. How are you?
I'm doing very well. Thank you so much, Lisa. I'm glad to be here.
Oh, it's so nice to have you. How's everything in San Francisco? I'm not feeling very sorry for you for living over there.
It's really nice. The weather is wonderful, and we have a nice sunny day today. It was raining a little bit yesterday, but today is nicer. Yeah.
I think that's one of my that's like in the top 3 of my favorite cities.
Me too.
I mean, Arizona's, in there too, obviously. I was born and raised here, so Scottsdale's not so bad.
Yes.
So we're here to talk about Neosis and the Yomi product. Can you please tell us, in our audience, about Yomi and your experience with the product?
Yes. So Yomi is a dental robot to aid the surgical placement of oral implants, and it's amazing technology. It makes the operation safe, precise, and give the surgeon peace of mind that at the end of the surgery he's going to get things perfect, because when you do surgery with Yomi, the precision is in the fraction of millimeter, which is very hard for the human hand to execute.
Right.
So that's basically, the summary of what Yomi is about.
So it's all about very delicate precision and accurate precision.
Correct. Okay. Correct. Yes.
So that would be how it differs from surgical guides or freehand surgery.
Okay. So I've been doing freehand surgery for a very long time, and the static surgical guides too. The static surgical guides are nice, but they have limitation. So quite often the patient can't open his or her mouth wide enough to get the burr and the surgical handpiece where it's supposed to go, because the plastic of the surgical guide is in the way. So Yomi will eliminate that kind of barrier, but is going to give you the precision. With freehanding, I don't know how many implants, but it's in the thousands in my life. And, a lot of times, I think that, that was before Yomi. I used to think that, I'm going to be able to do whatever, and get it done right. But there are those cases here or there where the patient move, you are having bad day, whatever, the circumstances are, you end up placing the implant in not so ideal location. And, if you are a surgeon or dentist, you live your life based on precision. And if you violate precision, basically, I'm speaking for myself, I don't know how to go and sleep well. So Yomi gave me that good assurance at the end of the day. When I go home, I know that I did my job well and I sleep well.
Yes, especially with placing implants. I mean, millimeters can make a huge difference,
True.
right? And
True.
where they go into the bone and
True.
the safety protocols and all of that.
Absolutely.
How long, Dr. Ali, how long have you been practicing implant dentistry?
I'd say, well, when I was about to graduate from Aleppo University in 1984, I did my graduation thesis on dental implants. Even I did not place implants, but that's where my dental implant interest started. And then when I came to the U.S., went to Loma Linda, and I was lucky enough to meet Dr. Philip Boyne back then, and he's one of the gurus back then in dental implants and bone grafting. So I'd say about 32 years ago, maybe.
Wow.
Yeah.
You were really ahead of your time there.
Yeah. So just, things happen. And, sometimes I think, I'm lucky that, things happen a certain way in my life, and I met the right people who were mentoring me to take the right path.
Were you a Mish Institute advocate?
Well, I know Dr. Carl Mesh.
Yeah.
I have his books, and I took some weekend courses by him. Mm-hmm. And I read his textbooks. So so
I just figured, since you go that far back, that he was probably one of those that you studied.
Yeah, so he's one of the people who also influenced me, in my treatment planning and my whole judgment, when it comes to how to do dental implants. Yeah,
nice.
Right.
Nice, very, very cool. So, what is the learning curve like with Yomi added to the practice?
Well, there is learning curve, but it's not really very difficult learning curve, and I still learn every day until now. I've been having the Yomi now close to 2 years, and I still learn every day, but I was comfortable from month one to have the Yomi in every implant case I do.
Mm-hmm.
Yeah. So
wow.
So it's not like, something would be inhibitive and you'll prefer to go other route. No, not that. But, the nature of, doing surgeries and dental implants is basically to continue to learn and, add little pearls every day, as you practice.
Yes. Now, is there lots of training that comes with Yomi when you purchase it for your office?
Actually, Yomi Neosis had excellent teams. So they sent 3 or 4 trainers to my office to train me on my own robot and train my staff and prepare them and make them comfortable. And then when they finished the training, I thought, that that kind of support has stopped, but actually, I was wrong. Yomi Neosis continued to support me. So even until now, I do have Yomi technical representatives coming to my office and training my staff and keeping them updated, updating the software. So it's continuous support. I think this is the most support I got out of any technology I acquired in my office.
Oh, wow.
Yeah.
That's a big statement.
It is.
I love to hear that because as we all know, these machines they're not cheap. They're not inexpensive. So would you say that it has already paid for itself within your practice?
Of course. So, when I acquired Yomi, I really wasn't looking for the return on the investment. I was looking for my self-satisfaction, and I was looking that, I have patients who, when they come and do business with me, it's business based on trust, and I should execute, that trust to the highest level. So that's what drove me to acquire, Yomi as a piece of technology in my office. But amazingly, our consumers now, they are very smart, and they do their homeworks very well before they come to the consultation. So you have the internet, and you have a lot of resources for the patients to get self-educated.
Dr. Google.
Yeah. So
we all like to go to.
Yeah. So we are in a new era, where the consumer is way, way smarter than what it used to be, before the internet, Google and all other, search engines were available to consumers and people. Yes.
Right. Absolutely. I mean, obviously, you're putting your patients first, and bringing in the latest technology into your practice to do that. That's really great. I love to hear that. How do your patients feel about it? I mean, are they standoffish about it, or are they like, oh, this is so cool because it's latest technology, and are they adopting it well? Or do they give you any feedback at all and just lay there and say, do what you need to do, doctor?
Okay, well, here, the biggest feedback for me, I've been training myself to do very minimally invasive surgeries even before Yomi. But when Yomi was available to me, it just took my minimal invasive surgical techniques to a much higher level. And that basically would reflect on the post-operative morbidity, so like I did full arch the day before yesterday. The patient came yesterday for, the day after surgery, and I asked him, how is he doing? And he said that he doesn't feel any pain at all. It's just, just the gum sore. And I placed how many implants? I don't remember, but it's 6 or more implants in the maxilla. And
wow, that says a lot right there.
Yeah. So the minimal invasiveness and, the comfort the patient have, and the less swelling and all those kind of good things, instill more confidence, with patients. And then, patients live within society, so they're going to go and tell their story to their friends and families. So yeah, I think it's very positive.
Yeah, when the patients are taking less Tylenol, you're taking less Tylenol.
For sure. I agree.
They're happy, and I mean that's all you can ask for. Is that's amazing. If you did a full arch and he's in zero pain, that's awesome.
Yeah.
Wow. So looking back over the past few years, how has this product changed your attitude towards practicing implant dentistry?
In general, I'm a confident person, but it just made me more confident, gave me peace of mind that I'm gonna get right each and every time, and made me a happier person with myself that I'm doing a good job. So yeah, it's really very nice technology for what I do. I think, if I'm gonna pick the top 3 technologies in my last 35 years of dental practice, Yomi would be one of them. It's just
Yeah, it's just that good. So I know you said that obviously your main goal is not the ROI and to monetize this, but for our listeners out there that would be thinking, I mean, obviously taking care of patients is first, but the monetization factor of it.
Yes.
Speak to a little bit of that and how, I mean, I'm assuming it enables you to see more patients and just an overall better workflow.
That is correct. So, even it wasn't my intention, but like I told you, the consumer is much smarter. So now with, like the patients I get some patients from other states coming just to get their dental implants done by that technology. So it is growing my business. Much busier practice. I do restore my implants, and I'm at the stage now where I'm very busy. I have to hire an associate to a prosthodontist to take care of the process. The process.
Good problem to have.
Yeah, good problem to have. So yes, it does draw, a lot of clients, and it make you busier, and it is wonderful, tool to grow your practice.
Do you have any idea how many implant doctors out there are using the product, the Yomi? Do you know?
I'm not sure, but I was number 48.
Oh wow!
So when I got Yomi, I was number 48 worldwide. So
wow,
yeah.
So you're one of the early adopters.
So I'm one of the early ones. Yeah, my great friend Dr. Antonios, the late Dr. Antonios, he said, Mohamed, if you wait one more, you'll be the 49er, and you'll be perfect for San Francisco.
Oh, yeah, that makes sense. That's a good one. Oh my gosh. So, what do you think about robotics in dentistry long term? Do you think that this is going to be the new standard of care?
Definitely. You have to think this is a better way to practice dentistry. It's going to bring precision. It's going to bring safety with the precision. So if you are placing implants in the mandible, you're going to play your implant surgery safe for the patient. So you're going to stay away from the inferior mandibular nerve, and you're going to stay away from the associated arteries and blood vessels, So it is much more safe also way to practice implant surgery. So it makes things safer with the precision. You can place your implants, because dental implant surgery is prosthetically driven surgery. So the more precise and the more ideal the implant location is, the more survivability your result is going to have and long term. So if you place your implants, in the right location and support, the bridges or the crowns in proper mechanic, you could attain a lifetime result. And this is very outstanding. So
what would you say the percentage of extra precision that this product gives you when you're placing the implants?
Well, I cannot match the precision of Yomi with my freehand. So that is,
you're just able to see, I mean, as far as like you're talking about arteries and, obviously it's a delicate surgery. So
yes. So like, in the mandible, you don't do impingement on the inferior mandibular nerve, or like, the lingual artery. You don't do fenestration for like, the buccal bone plate or the lingual bone plate. So your implant is placed properly. The same thing applied to the maxilla, and it's really wonderful.
Yeah, it sounds amazing. Neos is such a great company. They really are very ahead of their time with the technology. What would you say to your colleagues and our listeners who place implants using guides or freehanding now that we have this product out?
Well, I used to think that I'm really good in freehanding, placement of dental implant. And with Yomi, I don't think, I could match, the precision of Yomi. So it will exceed the precision of a normal or even experienced, surgical hands. So if you do dental implants and if that's what you like to do, I think it's very imperative to have that technology.
Right. Do you have a lot of doctors that will call you and ask your opinion on it since you've used it for a while?
Yeah, I got quite a few, dentists, and they ask me about it, and they ask me what I think about it, and
because I have 4 magazines in dentistry now, I know they all like to have an opinion.
yeah.
They all want to ask their colleagues about the products for sure, right?
That is true. So yeah, so there is no question that this will elevate your dental implant services to much higher level.
Wow. That's a big statement. That's good. That's good. That's what it should be doing.
Yeah.
Now, Dr. Ali, what do you do in your free time? It seems like you work a ton.
Okay, well, I just came from the gym, so.
Oh, nice.
So you are the first on my schedule after I finish my workout. And I do have 3 children, 2 girls and a boy, and they are 24, 22, and 19. So they are really intellectual and smart, and I enjoy my time with them.
Yeah.
My wife is my best friend, so yeah. So she's my wife, and she's my best friend. So yeah. So that's basically, my family, my kids, my wife. That's what I do, and we travel. We enjoy things together. So yeah. I'm a very simple man.
Well, that's the most important stuff right there. That's the secret sauce.
Yeah. So yeah, keep it simple.
That's it. I love to hear that about your wife and your family. That's so cute. That's good. You got to have a good work-life balance, right? If you don't have a good team at home in your corner, it makes it harder for your career, right? So
of course. Yeah. So you have to have things balanced, otherwise, if you lose that balance, you will not be happy, and professionally, you'll not do as well.
Well, Dr. Ali, balance is my goal for 2022.
There you go.
I'm hoping that I can achieve this. We're almost halfway, a little bit before halfway through the year. So we'll see what happens.
Yeah.
That sounds like a good plan, right?
Yeah. It is a good plan.
Yeah. Thank you so much. This was such good information for our listeners, and I'm sure they're going to get a lot out of this and want to check out the information on Neosis and the Yomi product. And do you have anything else to say about it?
No, just, for you, the one who's hesitating whether you're going to do your implant free-handed or with this technology, I can tell you, that if you go with Yomi, you will place all your implants with Yomi, so you will never go back to the freehand placement of implant. So this is excellent technology. It's going to instill confidence in your patients that you are doing the right thing for them. And if you want to think about the return on the investment, don't worry too much about it. Good things will happen.
Excellent. That's good advice, good information. And I thank you so much for your time and joining us today on Doc Talk Dental. You come back and visit us again.
It's always a pleasure, Lisa. Thank you so much.
Okay, thank you. We'll talk soon.
Yes, thank you so
Bye.
much.
Bye-bye.
Bye-bye now. Thanks.
Well, that's going to do it for another episode of Doc Talk Dental. I'd like to thank Dr. Mohamed Ali for joining us today. And I'd also like to thank our sponsor, Yomi by Neosis. For more information, please visit neosis.com. That's spelled Neocis. As always, for everything implant related, please go to implantpracticeus.com and subscribe for the latest information. To learn about any of our other publications, visit medmarkmedia.com. We'll see you guys back here on the next edition of Doc Talk Dental. Until then, take care, everyone, and be safe.
Thanks for listening to Doc Talk Dental. You can always stay up to date with our latest podcast by subscribing on Spotify, Apple Podcasts, and Google Podcasts. Learn more about us at Medmark Media, or connect directly with any of our publications at Orthodontic Practice US, at Endodontic Practice US, at Implant Practice US, and at Dental Sleep Practice. Until next time.